Thank you so much for joining us this evening. My name is Alex Lawson. I'm the Executive Director of Social Security Works, along with our allies who you're going to be hearing from tonight. We've put together this town hall so that you all can take part and be the voice and the muscle behind the defense of our healthcare, because that is what is going on right now, is a full assault on our healthcare. I'm going to introduce our first speaker, but first I want to say why we're doing the live stream right now is that currently the Senate Democrats are on the floor of the Senate, and they're holding the floor for as long as they legally can in order to expose the dangerous agenda of not just RFK Jr., but the Republicans who are putting him in the position to just attack and destroy our health care. And we're going to hear from so many people today representing the millions of Americans with one voice. Nobody voted to destroy healthcare. Nobody voted to destroy Medicaid. We are going to unite our voices and do everything we can to expose this incredibly dangerous agenda that RFK Jr. and the Republicans are trying to force on the American people. So first up, I'd like to introduce our co-host for this evening and a leader who's done so much work exposing RFK Jr. and the dangers to all of our health care, the president of Protect Our Care, Brad Woodhouse.
Great, Alex. Thank you. And I am really sorry to be joining you tonight. I mean, this is just a situation where in a logical world, in a world that, had the other party caring about the healthcare of the American people, about public health, we wouldn't have to do this live streaming. We wouldn't have to do this. We wouldn't have to do this work. But I will tell you that this is so important. I mean, just today, in Washington, D.C., we have a bulldozer rolling over American healthcare, and its name is Elon Musk, Trump, and Republicans and RFK. I mean, we've had competing budget resolutions in the House and the Senate, which will slash Medicaid from millions and millions of people to give tax breaks to the wealthy. That's their plan. They're going to do it. They're trying to do it. We're fighting it. But that is their plan. Up to $2.2 trillion in cuts to Medicaid. We've seen the freeze, and I think maybe they've just unfrozen. We saw the freeze on NIH grants, which really kind of amplifies like the craziness of what we're getting ready to see, or what we're seeing on the floor, particularly from Republicans who are going almost to a person are going to support RFK Jr. So just, we had this freeze on NIH grants and funding and indirect cost. And, we've had a lot of Republicans, typical of them, and Susan Collins, express concern about the freeze on NIH funding and what it means to research into infectious diseases, cures. But here they are tonight or tomorrow morning. They're going to vote to put in place the architect of destroying NIH. I mean, remember, RFK Jr. campaigned on ending infectious disease research. He campaigned on dismantling NIH. He campaigned on slashing employment at NIH. He said, we're gonna send these scientists off, and they're gonna go do something else. So, Republicans are concerned, but not so concerned that they would find someone other than RFK Jr. to lead HHS. So we Protect Our Care launched launched a campaign to stop RFK as soon as he was announced. We have run that with so many of you on this call, and it's because we believe he is a unique threat to American healthcare, a unique threat to public health. First of all, Senator Murphy participated in a press conference with us ahead of the Finance Committee hearing on RFK's nomination, and he said what I believe is you could walk down the street and the first hundred people you ran into would be more qualified to run HHS than RFK Jr. He doesn't possess a single qualification, a single bit of experience, a single educational degree or anything else that would qualify him to do this. But beyond that, he is a unique threat. He's a conspiracy theorist who doesn't believe in vaccines. He's anti-vaccine. He's not a skeptic. He ran an organization that encouraged people not to get vaccinated. He went to Samoa and encouraged people not to get vaccinated for the measles. 83 people died, almost exclusively children and infants. He sat there and was begged by Senator Cassidy in the committee that Senator Cassidy chairs, begged him to roll back his conspiracy theory that measles are caused by childhood vaccinations. And he wouldn't do it. Now, Senator Cassidy folded under pressure from Elon Musk and Trump and is going to vote for him. But there's not been a single public pronouncement that RFK Jr. doesn't still believe that in the debunked and dangerous theory that preys on parents, still doesn't believe that that childhood vaccines cause autism. So he is a unique threat, but he's not the only threat. I mean, we have seen the rampage that has gone wild in Washington, D.C. On American healthcare, Medicaid cuts for tax cuts, freezing NIH, the threat to end CDC altogether, and now folding to the whims of Donald Trump and Elon Musk to put a know-nothing grifter, conspiracy theorist, and dangerous human being in charge. And that what's so important about what we're doing and what our senators are doing on the floor tonight is we got to hold them accountable. They have to be held accountable for the outcome. With that, back to you, Alex.
Thank you so much, Brad, for that and for all the work that Protect Our Care has done and will continue to do to stop this dangerous assault on our health care. And again, I want to show people what's going on the floor of the Senate right now. You have so a Republican who is going to be trying to make the case that this man, as Brad pointed out, he has zero credentials to be put in charge of the agency that controls all these aspects of our healthcare. And he was very open about many of the things that he wants to do. Privatizing Medicare completely. He wants to turn Medicare over to United Healthcare so that they can delay and deny and make so much money off of harming the American people. That's his plan. He wants to make everybody have to deal with United Healthcare instead of traditional Medicare. He wants everybody to face delays and denials to their health care. And that's just one aspect of this multi-pronged assault on our healthcare in the United States of America. Something that Brad brought up that our next speaker can speak to extremely well is the importance of Medicaid to the American people. And the fact that the Republican plan is just to totally destroy Medicaid. There's talking about, oh, well, it's just $2.3 trillion. You're like, that's a total destruction of the program. And so I want to introduce Service Employees International Union Executive Vice President Leslie Frayne to speak about the work that SEIU has done with the care workers and the healthcare workers that you represent, and the threat and what it would mean for the American people if the Republicans, get their way and destroy Medicaid, the largest provider of long-term care in this country. So, Leslie, thank you so much for joining us on this important forum.
Thank you, Alex, and thanks to Brad as well. As Alex said, I'm Leslie Frayne, Executive Vice President of the Service Employees International Union, and I'm very glad to be here speaking on behalf of the 2 million members of SEIU. Our members include just over 1 million healthcare workers. That includes hospital workers, nursing home workers, home care workers, and many others. And, SEIU members, and in fact, all healthcare workers, worked throughout the COVID pandemic to care for their patients. And they did so often at enormous self-sacrifice. I think a lot about Francine Bailey, who's a member of ours who is a nursing home worker in Connecticut. And she got COVID early during the pandemic and had a tough time of it. She was out of work for about 3 weeks. Francine thankfully recovered, but Francine lived with her elderly mother, and her elderly mother got COVID from her and didn't make it. And Francine told me at the time how she feels every day living with the knowledge that her dedication to her patients, to the residents that she cared for in her nursing home, had ultimately cost her mother her life. And I think of Francine frequently these days because I know that, during the pandemic, our members and all healthcare workers got told over and over again that they were heroes. But what they really cared about wasn't what was said, but what was done to keep them safe. And so the idea that the Department of Health and Human Services could be overseen by somebody who privileges superstition over science when it comes to public health just really makes our blood boil. And on behalf of healthcare workers everywhere, I call on the Senate to reject RFK Jr.'s nomination as Secretary of the Department of Health and Human Services. Last week, 350 SEIU members from all over the country, including from Alaska to Florida, from Maine to California, traveled to DC to talk with their elected representatives in Congress specifically about Medicaid. And as healthcare workers and other public employees, our members shared with their representatives what slashing Medicaid funding would mean for the people that they care for. Starting with the 32 million kids who are on Medicaid, many of whom need special ed services or mental health services or services for people with intellectual and developmental disabilities, all of which are funded by Medicaid. The 17 million seniors and people with disability who rely on Medicaid for their care. Medicaid is the majority funder of nursing home services in this country and also the majority funder for home care. Also for the tens of millions of working adults who are on Medicaid, and they're on Medicaid because their wages are so damn low that they can't afford private insurance or employer-sponsored insurance. And in their conversations with elected officials, our members were crystal clear. When it comes to Medicaid, cuts are cuts. And whether you do it through something called per capita caps, whether you do it through block grants, whether you do it through work requirements, it doesn't really matter. Whether you do it through provider tax moratoriums or you do it through FMAP cut, all of the cuts have different names and different formulae, but what they all mean is that a big chunk of the 80 million people in this country who rely on Medicaid for their care lose access to that care. Cutting Medicaid means that safety net hospitals, including rural hospitals, close. Dollars for nursing home care and home care services dry up. Cutting Medicaid means that there are fewer services for healthcare workers' pay and benefits. Among other things, that means that employers can't recruit and retain the staff that they need, and there's already a crisis with insufficient numbers of healthcare workers, particularly in the long-term care space. Cutting Medicaid means instant budget crises in red and blue states alike, since Medicaid accounts on average for about 30% of states' budgets. So if states don't want to slash healthcare to the bone, they're going to have to slash other public services, the services that all of us rely on to have the kind of quality life for ourselves, for our families, for our communities that we need. But in addition to being clear about what the consequences of Medicaid cuts would be, our members in their conversations with their elected officials tried to be crystal clear about why those cuts are at the top of the list, that they're at the top of the priority list for Republicans in Congress. And it's not that either the president or MAGA leaders in Congress care about healthcare. Personally, I don't think they give a damn one way or another about Medicaid. It's all very explicitly, and I think Brad made this point eloquently, it's explicitly about funding tax cuts for the wealthy. And they go after Medicaid for a specific reason, because there's a narrative that the folks who rely on Medicaid are poor people and people of color. Now, that narrative isn't strictly true, but that narrative emboldens them because so many of the elected officials in Congress on the Republican side of the aisle think it's okay to throw poor people and people of color under the bus. That will never be acceptable to our members, nor to the other speakers on this call, nor to the many courageous advocates for Medicaid in Congress and in our communities, advocates who are standing up and fighting back. And so I want to close my comments by thanking you all for your advocacy. Thank you to Protect Our Care. Thank you to Social Security Works. Thank you to Public Citizens and so many others. I want to do a special shout out and thank you to the senators who are speaking out today and tonight from the Senate floor. Together, we're going to keep up the fight to protect healthcare and other essential services, because we know that Medicaid saves lives, and we are unwilling to stand idly by while healthcare is ripped away from the millions of people who rely on Medicaid for their access to care. Together, we're going to demand that Congress keep its hands off Medicaid. And I want to thank you again for your advocacy and for having me here today.
Leslie, thank you so much for your work. And I just want to say, knowing that we're in this fight together, I think they've entirely misjudged what they're going to be able to pull off. The American people understand that the destruction of Medicaid takes healthcare away from us, from our families. And so we are going to be united in fighting against that. And a true champion in that fight is our next speaker. And I'm very proud to be able to introduce Senator Chris Van Hollen from Maryland, who I have actually stood with multiple times this week against this billionaire-led assault on so many of our systems right now, basically on the entirety of healthcare. Senator Van Hollen, thank you so much for joining us this evening.
Well, Alex, first of all, thank you for all your efforts. It's been good to be with you this week as we fight back from the Elon Musk illegal takeover of so many federal agencies. It really is the most corrupt bargain we've ever seen in American history. He spent $280 million plus to elect Donald Trump, and now Donald Trump has given him the keys to the federal government. And this has nothing to do with government efficiency. It has everything to do with empowering very wealthy people by stripping away protections for the American people and laying the groundwork for tax cuts. Thank all of you who are part of this gathering right here. I will be going to the Senate floor later this evening to speak out against the nomination of RFK Jr. to be the Secretary of Health and Human Services. You know, of course, he's unqualified. He has no qualifications to do this job, but it's actually more dangerous than that, right? If we were just to pick somebody off the streets to be the head of Health and Human Services, they would also be unqualified off the street. But he is dangerous because in addition to being unqualified, he has spewed forth these conspiracy theories that threaten the lives of millions of Americans and our kids in terms of his conspiracies about vaccines for the American people. You know, I have a quote here that I want to read. It says, and it was a quote from 60 years ago, and here's what it was. Quote, "I hope that the renewed drive to provide vaccination for all Americans, and particularly those who are young, will have the wholehearted support of every parent in America," end quote. That was President John F. Kennedy calling upon parents across the country to make sure their kids get vaccinated to protect themselves from polio and other diseases. RFK Jr., his nephew, clearly didn't get the message from President Kennedy. In fact, he got the opposite message, the dangerous message that we should spew forth these conspiracy theories that will jeopardize the health and safety of Americans. He also said that when if he's confirmed, that he's going to walk into NIH and immediately toss out 600 people and replace them with his cronies. This is obviously very dangerous. I'm proud to represent the state of Maryland. It's home to the National Institutes of Health. It's also home to the FDA. And it would obviously wreck our medical research efforts in the United States if RFK Jr. gets the keys to NIH. We've already seen the effort of the Trump administration to change the formulas, the way in which we provide federal funding for medical research. It would destroy our ongoing efforts to find cures and treatments to diseases like cancer. Fortunately, a federal judge has jumped in and issued a temporary restraining order against that. But giving RFK Jr. the keys to NIH would be a great danger to all of our efforts to develop cures and treatments to diseases like cancer, like Alzheimer's, and so many others that impact every American family. Let me just conclude with this. I just came from the Senate Budget Committee. Ron Wyden will probably be here shortly because he also serves on that committee. I know he's planning to join us. But I offered an amendment to the budget because the Senate Republicans are working on this reconciliation process right now. They're laying the groundwork to provide huge tax cuts to the wealthiest Americans and do so at the expense of everyone else in America. And so I proposed an amendment that would at least protect and prevent cuts to Medicare and Medicaid as part of this reconciliation process, creating those guardrails and saying that you can't go there. You cannot cut Medicare and Medicaid. Unfortunately, on a party line vote, Republicans rejected those safeguards. So we've got a hell of a fight in front of us. You know, Donald Trump did not campaign on cutting benefits to Medicare or Medicaid. He didn't campaign on destroying the National Institutes of Health. And in fact, when he was asked about Project 2025 on the campaign trail, you remember what he said? I don't know what that is. I don't know who they are. Now he's installed the key architect of Project 2025 Rest Vote at OMB, which is like the cockpit for the federal budget process. And they are working with Elon Musk, who's doing so much of the dirty work, to implement Project 2025. And I'll close with this. The reason Donald Trump didn't want to acknowledge Project 2025 on the campaign trail is he knew how terribly unpopular it would be with the American people. And he knew that if he endorsed it, people would go, "What the hell are you doing?" Well, that is what they're doing now. And we need to make sure that we muster all of our power in the courts, in the Congress, and around the country to stop what's happening. I want to thank all of you for being part of that effort to protect our country and protect the public health and the health of all Americans.
Thank you so much, Senator, for joining us here this evening and also for all of your work. And I know you're going to get out there on the Senate floor and keep fighting for us. And just know that what we're going to do is ensure that you and what you're doing is known to the millions of people who desperately need to understand that they've got champions in Washington, D.C. fighting for them. But right now, the Republicans have the majority. And so we need to make sure the people are raising our voices and making it undeniable that what the Republicans are trying to do is deeply unpopular and that the people are going to have their voices heard. And in the meantime, Senator, as you fight, know that you've got the people at your back. They might have the richest man in the world in Elon Musk, but you've got the people. So thank you again so much for all of your work fighting for our health care.
Well, thank you. And it's because of all of you and people around the country that we stopped their effort to repeal the Affordable Care Act. We remember that dramatic moment. Would not have happened except for the fact that the country tuned in, recognized the danger to their health care, and responded. So thank you for getting the word out.
Thanks again, Senator. And that's a great segue to our next key co-host of this event and a hero of mine, a literal tireless advocate for healthcare and also a stage 4 cancer survivor who can speak very directly to what the proposals would mean, what they would mean to her and what they would mean to millions of Americans. So I'm going to ask Laura Packard to join us on this town hall and talk about just how catastrophic the proposed cuts. Because in DC speak, they want to talk about it in budget terms. They want to, oh yeah, it's just moving numbers around on a ledger. I want everyone to be reminded by Laura that what we're talking about is human beings and their health, and that's what's at stake here. So Laura, thank you so much for joining us on today's town hall.
Thanks for having me. And I'm here because my life was saved based on science that was performed research in the 70s. They figured out how to cure my type of cancer for many people. But how many people are not going to get their cures because RFK Jr. is going to shut down research? We know he doesn't like vaccines, and that includes vaccines to prevent cancer. In fact, one of the vaccines that he has fought against, HPV, has virtually wiped out cervical cancer in the people that have access to it. And what's sadly ironic is that I was visiting a doctor getting checked for cervical cancer as the Senate committee was moving his nomination forward. Now, unfortunately, I didn't get that vaccine. I wasn't young enough to get it when it was discovered. But how many people are going to go through painful, invasive procedures and maybe even face cancer because of RFK's vendetta against vaccines? And it isn't even based on science. He refuses to listen to anything that disagrees with his worldview, including scientists and doctors that have told him repeatedly. In fact, Senator Cassidy begged him during the hearing to agree that vaccines prevent preventable diseases and illnesses, and RFK Jr. just wouldn't go there. So now this man is going to be in charge of America's health department. That is a clear and present risk for every American. You can agree that we all should have access to healthy food and be able to get preventative care and treatments. And that's not in dispute. What's in dispute is whether we should fund and support medical research. America is leading the world on finding cures for so many medical conditions, and he wants to just shut that down. And that is not acceptable.
Thank you so much, Laura. And your story and your advocacy is why I am so certain that we will win. Because when we stand united and raise our voices together, we cannot be defeated. And especially when we have champions in Washington, D.C., like our next guest, fighting for us tirelessly, I am even more hopeful, even in these bleak times where everything is under assault. I know that the American people did not vote for the destruction of Medicaid, the destruction of Medicare. They did not vote to shut down America's leading role in biomedical research. No one voted for that. And so I want to, it's my privilege to introduce Senator Ron Wyden, who just came off of one hearing and is going to be going to another one. So thank you, Senator, so much for making the time and for helping us organize this critical town hall to get the word out to the American people about what's happening in Washington, D.C. right now.
Well, thank you so much, but I want everybody to know I thought Laura's presentation was incredibly powerful, and I've got to take some of that out to the senators. Here's where we are. I just came from the Senate Budget Committee, where we are beginning the process of debating the priorities for the upcoming time. And, 3 times I tried to get Senate Republicans on the Budget Committee to say that they would take Medicaid off the chopping block. And again, they said, well, we're not doing it now. So it makes your organizing even more important, because I think for all practical purposes, they're saying, well, we're going to do it in a couple of months. We're going to do it in a couple of months, and we're going to go after your healthcare. We're going to go after your jobs and the green energy tax credits and the like. And I think your organizing is just crucial. So there are two lanes here right now, folks. One is the RFK lane, and I think that this is not just about decisions that are going to be made in the next few months if he's confirmed, but he is going to affect science for decades to come, and not in a good way. And medical students in particular are coming out of every possible community to tell me that message, and I think the grassroots work that you're doing can get it out. So if we stay after the cause of trying to get real science to govern at HHS rather than all these conspiracy theories and money generating schemes that we've heard discussed through all the hearings, that will help at HHS. And then we want your grassroots organizing to also go after these budget issues, because we can win on Medicaid. Most Americans don't even know that most Americans are working who get Medicaid. And somehow those that have been opposed to it keep saying, oh, they're not working. We need these really Byzantine bureaucratic, requirements to suggest that they aren't working. We can win these fights. But I'll mention just one thing, and that's political change hardly ever starts in DC and trickles down. It's almost always grassroots up. So thank you for what you're doing, because both with respect to getting good science at HHS rather than crackpot politics, and making sure that we protect Medicaid and vital health programs on these budget issues, two really key areas for your activism right now, and making sure that every senator hears from the grassroots.
Thank you so much, Senator Wyden. And yes, I agree with you. Politicians are usually the lagging indicator. The people are the leading indicator. And that's why this inside-outside work is so important. But we need to get the American people to understand that we need to raise our voices as loud as possible right now to help with all of the fight that you're in Washington, D.C.
Let me mention just one other thing real quickly. When I heard from whistleblowers in the first spending freeze that the Medicaid portals were facing all these problems in terms of seniors and others being able to get information about medicine and nursing homes and the like, and the Trump people saying, oh, of course we want to protect Medicaid. What happened is I put it online, something went out to all 50 states, and then you guys and other wonderful advocates said, we are not going to just stand around when they harm Medicaid, and particularly the Medicaid portals that get people so much valuable information. That was an example of how all of you and other advocates within 24 hours changed the politics of that issue, and they had to stand up and make sure the Medicaid portals were available. So congrats on showing that you can win. We just have to have more wins.
That's right. That is exactly right. When the people speak up, they cannot be ignored. Senator, thank you so much for your leadership and your time this evening. I want to now introduce and actually turn the program over to our co-host, Rob Weissman, who is the president of Public Citizen and has coordinated and organized this town hall with us. Rob?
Thanks, Alex, and thanks to you and Social Security Works for your leadership on this and so many issues. Thanks, everybody, for tuning in. I think we learned two important things, among others, in the conversations we've just been having. Senator Wyden reminded us that we've already defeated the Trump administration on an important thing. They were serious about trying to freeze all federal spending. And within 48 hours, popular outrage forced them to reverse policy, deny that they really meant it, and open the spending back up again. So when we mobilize, when enough people are outraged, it makes a difference. And Senator Van Hollen reminded us about doing the same thing in the first Trump administration with the Republican efforts to repeal the Affordable Care Act. Trump ran on that one. The Republicans had talked about it for years, and they failed. And they failed because people mobilized, people were outraged, people were in the senators' faces and stopped it from happening. So as we're facing some really difficult challenges as we go forward, we have to remind ourselves that when we activate, when we connect, when we organize, when we mobilize, we do in fact win. Now, we're talking a lot about Medicaid and Medicare today in the context of the nomination of Robert Kennedy to be Secretary of Health and Human Services, because that department deals with Medicaid, Medicare, and provision of healthcare. Robert Kennedy likes to talk about a lot of things. Some of them have to do with what HHS actually does. A lot of them don't. But he also tends to avoid talking about the core issue for the Secretary of Health and Human Services, which is, do people in this country get access to the care they need? Do they get access to affordable healthcare coverage? Can they pay for the drugs they need? Or do they have to ration care or go without care, go into deep medical debt? He didn't talk about that. He didn't talk about that. He hasn't talked about it, except to say when pressed, he wants to make the problem worse. He wants to privatize the Medicare system. He's on board with slashing Medicaid. Now, why is that so important? It's so important because as of today, we know what the Republicans are planning going forward in the tax and budget fight known as reconciliation as regards healthcare. And Robert Kennedy, if he cared about providing healthcare to people, should be telling the Republicans, stop, we got to change because you're about to make a bad situation for healthcare in this country far, far worse. It's a little complicated what just happened today, and it's worth taking a second just to understand what the Republicans have proposed on the House side. They adopted a resolution, a framework for how they're going to deal with this tax and budget issue called reconciliation. The number one purpose is to extend and give more tax breaks to the rich and corporations. So they've committed to doing that to the tune of $4.5 trillion over the next 10 years, or maybe more. $4.5 trillion. But what they said was, we won't do that. We're going to discipline ourselves, we Republicans, in giving these gigantic tax breaks. We'll only allow ourselves to do what we most want to do, give tax breaks to corporations and the super rich, if we cut spending. Right? We can only get to the $4.5 trillion in tax breaks if we cut $2 trillion in spending. There's only one way to get to those grotesque levels of spending cuts. And that's by slashing Medicaid and indeed Medicare, which they're now putting on the table. Now, it's always the case that we talk about the rich don't pay enough. That's always the constraint for why we're told society can't do what it needs to do to take care of housing crisis, to make sure everybody's educated, has access to early childhood education, to make sure we can invest sufficiently to deal with the climate crisis, why people can't have health care. So that's always true. There's always a budget constraint, and the budget constraint is always because we're not taxing people who have a lot of money enough. But this is not like that. This is a totally different situation. Every dollar they cut from Medicaid is directly going to go to pay for tax breaks for the rich and corporations. They are literally taking money away from the most poor and vulnerable people in society and denying them health care and putting it in the pocket of corporations and the super rich. So that is the number one healthcare issue facing the country today. Robert Kennedy doesn't say, hey, actually, my job is going to be to provide healthcare, make sure people have access to healthcare, and ensure that they get it. He's silent on it. He's silent on it. Or he says, yeah, some limitations on Medicaid, that's fine for me. So we know what he's going to do. He's going to go along with this unbelievable theft, taking from poor people giving to rich people, denying health care to pay for tax cuts for the rich. That's what Robert Kennedy is supporting. That's what Robert Kennedy is supporting. Something else interesting happened today. The United States government declared that it's not going to share information on its surveillance of flu outbreaks with the World Health Organization. We're not going to share information we collect about flu breakouts in the United States with the World Health Organization, so there can be a coordinated global effort to deal with influenza. We're not going to share this information in a system that we helped set up at the World Health Organization. Well, this is an indication of what we should be expecting from Robert Kennedy. This is if he didn't direct this, it's exactly in line with what he's promoting. Destroying public health, turning away from infectious disease, sabotaging science in service of a conspiratorial anti-science agenda. It is a certainty that people, if this goes through and is maintained, people are going to get sick and die for no reason except for the Trump-Kennedy adherence to this extremist, pointless, ideological, conspiracist, anti-science agenda. That's what we're looking at from Robert F. Kennedy. We're going to have a vote on Robert Kennedy. There is not a senator in the United States Senate who believes he is qualified to be Secretary of Health and Human Services. There's not one. They may be ideological, they may be foolish, they may be corrupt, some of them may be a little bit dim, but no one believes that Robert F. Kennedy is qualified to be Secretary of Health and Human Services. But the Republicans have shown they are willing to set aside their awareness of that fact to go along with Donald Trump and the Elon Musk co-presidency, the co-authoritarian presidency. So they are putting the nation at risk, and it's really an understatement to say the nation's at risk, because if Robert Kennedy is confirmed as Secretary of Health and Human Services, as he spreads his anti-vaccine crusade, as he spreads doubt about public health measures, as he sabotages good science, as he undermines and perhaps really damages the National Institutes of Health and the nation's research base, as he compromises safety at the Food and Drug Administration, as he supports the privatization of Medicare, as he supports the restriction of Medicaid to the poorest people getting healthcare in this country, it is a certain that we are going to have more disease, more illness, more misery, more corporate profits for no reason except to serve his conspiratorial anti-science agenda. That's the reality we're facing. If he is confirmed, if we're not able to block him as his nomination comes to a vote, then it's going to be on us to mobilize, as we were saying, to confront the various things he's doing. Those of us who are able to engage in litigation will try to sue to block what he's doing as much as possible. But the biggest picture items are going to go through Congress, and there we have power, if we mobilize, to block this plan to slash healthcare for everyday Americans in order to provide more money in the form of tax breaks to the rich and corporations. So it's a moment right now for us to keep pushing on every senator to oppose this preposterous nomination, but also to prepare ourselves for a gigantic struggle ahead. And it's one that we can win. We know we can win because we just won, because we won in the first Trump term, because they're setting this up in a way that makes it so clear how they're taking from the poor to give to the rich. That's what we have ahead of us, and today, tomorrow, and in the weeks and months ahead. With that, let me turn it over to Senator Peter Welch from Vermont, a great champion of healthcare, a man who understands precisely that healthcare shouldn't be auctioned only to those who can afford it, but is a human right that should be available to all, who wants not to privatize Medicare, but to expand Medicare to ensure that we have Medicare for all, and who's been leading the charge against this preposterous nomination of Robert Kennedy. Senator Welch, thanks so much for joining us. Over to you.
Thank you, Robert. And everything you said, I agree with. And it's pretty amazing that we have to be sitting here talking as though there's a serious candidate to be the next HHS secretary in the person of Robert Kennedy. You know, a couple of things. Senator Wyden's Finance Committee hearing on Kennedy was pretty amazing thing to sit through. First of all, you know, the three issues I think under consideration for any nominee: character, competence, and priorities. And I asked myself, wait a minute, why are we here? Because keep in mind, Robert Kennedy was running for president. He was running as a Democrat, and he lost. He didn't get any support, and his campaign blew up. It was a pretty strange campaign all the way through. He goes to Trump and says, hey, I'll support you if you make me HHS secretary. So that's the quote qualification. It was a political payoff by a candidate who was defeated and by the front runner, Donald Trump, who said, hey, no problem. You know, I'll trade you HHS, you give me your support, whatever that was. But hardly a qualification to be the Health and Human Services secretary. So then we have the hearing, and Kennedy is there. And then the character question, it was an astonishing, as you know, letter and video that his cousin, Carolyn, presented. But what she outlined really does go to the character question. Anybody who's going to run a major governmental organization that has so much responsibility for the health and well-being of all the citizens of the country, they've got to have some character. And, you know, let's just acknowledge that pretty weird behavior, you know, putting chickens and mice in a blender to feed your hawk, dumping a dead bear in Central Park, thinking that's kind of funny. And then, you know, some tragic revelations by Carolyn Kennedy about the role that RFK Jr. played in encouraging some of his own family members to start using drugs. I mean, it's really, really kind of discouraging, disheartening. And I, in a lot of ways, hate to bring it up. But on the other hand, isn't the character of a person who is going to be a cabinet official relevant to consideration about their capacity? I certainly think it is. And just a lifetime of kind of strange and erratic behavior does not give me the confidence that that's a person who can manage a very large organization. Then the competence, you know, there's no experience. You've got to know about science. You've got to know about medicine. You've got to have some organizational ability to run a large, complex organization. By the way, that's not easy. It's not like you just dial it in, even if you're, quote, a candidate. And there is no science background. There's no managerial background. There's no healthcare policy background. What there is an immense amount of advocacy for anti-science theories, including vaccines. So you don't see in the history of a man who's had a long history of advocating for more access to healthcare. You don't see an advocacy for more affordable healthcare. Basically, you see an anti-science advocacy to raise enormous questions about the validity of vaccines and their efficacy. And by the way, this is something that I found very, very interesting. He went and attacked the COVID vaccine. It was about 6 months after it came out. And if you remember through that whole thing, our whole hope was that we'd get a vaccine quickly and be able to get injected and get the benefit of a vaccine to protect us against the virus. And you know what? This is the one thing that Donald Trump, I thought, did well during COVID. Everything else was pretty much a disaster. But the federal government mobilized resources to create incentives for the drug companies to develop this vaccine. And then we, by the way, negotiated a price on it. So when it finally came up, it was affordable, but also began funding the capacity to manufacture at high volume so we could get the vaccine once it was created, disseminated, so that we could all benefit by it sooner rather than later. And by all accounts, that saved hundreds of thousands of lives. And Kennedy said that was a total disaster. So incredibly bad judgment about something where we actually had enormous evidence and enormous benefit from what the federal government played a major role in doing, and that was producing and manufacturing the vaccine. So hardly a calling card for credibility with Kennedy. So, the character issue that I mentioned, the competence issue, the anti-vaccine conspiracy that just really accelerates the anxiety and uncertainty people have, his role in Samoa with measles. I mean, my goodness, measles, it was, a vaccine I got when I was a boy in my generation was the one that really benefited by, of course, the polio vaccine and the measles vaccine. And when I think about Kennedy, and I think sometimes about my parents when I was a boy, Kennedy sowing all this doubt about vaccine and creating a lot of anxiety in parents who have young children and whether they should or shouldn't get vaccinated. And I think back to when I was a boy, and I remember my parents in the summer when I was going to a swimming pool, always being super nervous about that. And I couldn't quite understand why, but of course it was because of polio. And I can remember, even though I was at an age when I hardly noticed what my parents were doing, it was all self-absorbed. I can remember the relief my parents had when I went to Holy Name Grammar School and I got the Salk vaccine. It was just such a lifesaver, and it was a testament to scientific research, and it was a testament to the confidence we had in our medical community. And RFK is doing everything he can to unravel that. So, I want a Health and Human Services secretary who respects science, but I also want one who has priorities about really improving our public health system, who understands that the stranglehold that some of the actors in the healthcare system have to be brought to heel, including the pricing power of big pharma, including private equity that is going in and buying up hospital organizations, selling it off for real estate, bleeding it, and then destroying the medical purpose. I mean, these are things that are essential organizationally for us to have some confidence that we'll start moving in the right direction of more affordable and more accessible medicine. And I just don't hear anything out of Kennedy about that. So on all of these factors for me, the character, the competence, and the priorities, Robert Kennedy falls way, way, way short. And kind of it all is summed up in how he got the job. They made a political deal. You make me a HHS secretary, I'll support you. So thank you all very much. It's really so good to have the solidarity of all of us working together to just hang in there for the American people. Thank you.
Thanks so much, Senator. We so much appreciate your leadership. You're inspiring us. I hope knowing that you've got people behind you is inspiring you to push hard, lobby those other senators, and bring them around to some common sense.
Thank you.
Thank you so much. We're going to move now to hear from another healthcare expert, Dr. Reshma Ramachandran, who is an assistant professor at Yale Medical School, who is on one of the organizers and leaders of Doctors for America and heads their FDA task force, so has a very specific view on Robert Kennedy's nomination from that perspective, and who's a practicing doctor, and I think brings a lot of empathy and real-world experience to thinking about what it might mean to have a Robert Kennedy Secretary of Health and Human Services. Reshma, take it away.
Thanks so much, Rob. As Rob mentioned, I am a practicing physician. I'm a primary care physician at a federally qualified health center. I primarily see patients who are underserved, patients who are low income, and many of my patients who are on Medicaid, or Husky as we call it here in Connecticut, or who don't have insurance at all. So it was alarming to see during the confirmation hearings that Robert F. Kennedy Jr. had really no knowledge of how Medicaid works. and could not respond to basic questions about the system. This is the person who's supposed to be the top health official in the country, whose responsibility is for all Americans, and especially those who are enrolled in public programs like Medicare and Medicaid, yet he seemed to know little to nothing about it. So as Rob mentioned, I'm a leader within Doctors for America. I'm on the board of directors, and we represent 27,000 clinicians and trainees across the country from various different specialties. Our organization does not take any money from the pharmaceutical, medical device, insurance, or any for-profit healthcare industry. And we advocate for things like access to affordable healthcare, making sure that new drugs, devices, vaccines are truly safe and effective, and removing conflict of interest from our healthcare system. Our members and physicians around the country have been calling our senators day in and day out about Robert F. Kennedy Jr. because we see what the other health advocates and senators on this call see, that voting for RFK Jr. is voting to put our patients in harm's way. Voting for him is voting for stopping doctors from being able to do their job of taking care of patients and providing them the best care possible. And voting for him is voting against basic scientific principles that would lead to an influx of potentially dangerous foods, treatments, and supplements onto Americans. Now, there's a lot of people who talk about, well, that's his prior record. That's things of the past. He's a different person now that he's been nominated as HHS secretary. But we watched the confirmation hearings. Actually, several of our members were in the front row of the finance hearing, and we saw him spew misinformation, claiming that medications that are not even FDA approved for children are. That astonishingly, despite study after study, including a full analysis from the National Academies of Medicine, formerly known as the Institute of Medicine, disproving this multiple times, that falsely, he claimed that vaccines cause autism, a basic kind of scientific question that has been answered over and over again. And of course, aligning himself with the president in denying care to people across the country and denying access to scientifically proven reproductive and transgender care. His written responses to questions from senators were even more astonishing. When asked about a tweet that he'd written not too long ago, threatening to fire FDA staff because of his own personal disagreements with their scientific judgment, instead of providing reassurance, he said that he would have to look at employment and labor law to make sure those firings might be possible. That was particularly chilling to see. This is our national regulator that makes sure that new drugs, new treatments, new vaccines that we prescribe are truly safe and effective, that they do their due diligence in providing us as clinicians with reassurance when we prescribe these medications and treatments to our patients, that they have been vetted. And he's saying that he would actually want to get rid of staff, basically hamper the ability for them to do the vaccine safety studies that he wants, to be able to do due diligence on various issues that he's talked about, as a part of Children's Health Defense in front of the Senate, basically undermining our public health workforce altogether. We saw recently in the last few days, there's been kind of efforts from the White House and also from DOJ to really undercut and kind of gut public capacity in public health and in healthcare. And I don't see RFK Jr. as someone who's going to stand up to that. Instead, he's someone who's going to be complicit with those efforts to really gut our entire public healthcare system. And that leaves our patients, and especially our most vulnerable patients, without access to healthcare, without access to new treatments, and instead in harm's way. And really catering to those who can market the best, who can get their products out there to patients and be able to, market things that might be misleading. So, we as physicians have been very clear that RFK Jr. should not and is not qualified to be HHS secretary. And I'll just end with this. Several of my colleagues and I have already been experiencing the effects of RFK Jr.'s nomination. I'm a family practice physician. I work with also a lot of pediatricians, and we've had patients of ours, parents, come to us when we talk about vaccines saying that they actually want to hold off until they see what happens with RFK. They want to kind of delay vaccines. They want to see if they can skip vaccines, because some of them are actually very, hopeful that they might be able to not adhere to the proven vaccine schedule that's meant to protect their children against very common illnesses, including the flu, which is at a record high this year compared to, the last 10, 20 years. So that's been very, very concerning. We have seen a few patients that are also in a rush to get all their vaccines because they're actually deeply worried that with the nomination of RFK Jr., they actually might not get access to those vaccines in the future. So there are some patients who are actually seeing this as a warning sign that they better get the health care they can right now before he becomes HHS secretary, because it might not be available later on. So I'm very thankful for all the work that the senators on these calls and then public citizens, Social Security Works, and other health advocates have been doing to oppose this nomination. I was hoping that there'd be more major medical professional societies also standing alongside with us in opposing his nomination very clearly. But we know, at least for us as practicing physicians, we are opposed to him, and Doctors for America is definitely opposed to him to becoming HHS secretary. It's just a signing off on harm for all our patients and not anything good. I'll hand it off. Back to you, Rob.
Thanks, Reshma. Disturbingly compelling. Thank you for all you're doing. I know you spent a lot of time up on the Hill trying to communicate this to various senators. Do you want to say a word about how that's gone? What kind of reactions you got as you were trying to convey your own experience and facts to the senators?
Yeah, I think most of the time we try to speak from our personal experience, what it's like, to be a physician and talking to patients about healthcare, what it means for us as physicians to be able to have evidence, to be able to do our job well. And, senators seem to understand that. And sometimes they even agree with us. But then, a couple of days later, we look on the news and all of a sudden they've been voting in favor for RFK Jr. So privately, a lot more kind of concordance and agreement in terms of our experience and what this means in terms of potentially harming our patients and likely harming our patients. But in practice, and because of the politics behind this, voting against their conscience and voting in favor for RFK, unfortunately.
All right, thanks so much. I want to bring back into the conversation Laura Packard to really speak about the realities of the healthcare system, building what Reshma was saying, and what the RFK nomination means to patients and to all of us in this country.
Mm-hmm. Thanks for having me back. I was diagnosed with stage 4 cancer in 2017, and then I had firsthand experience of how the American medical system works or doesn't work because I had all of the things. I had surgery, I had chemotherapy, I had radiation treatments, and that was most of 2017. And while that was going on, Republicans in Congress under President Trump's leadership were trying to repeal the Affordable Care Act, which is paying for the insurance that kept me alive. Now, this was in a way a simpler time because the argument was on insurance coverage. But now we're getting into arguments about science and medicine itself. RFK Jr. should stick to what he understands, which is wellness influencing. If you want to know how to get muscly in your 60s and what supplements help manage whatever issues you have going on, he might be someone to talk to. Because again, health and wellness industry, not very well regulated. But also, it's not involving science. Researchers spend their lives in labs testing and discovering cures that we all benefit from. And unfortunately, maybe some of these cures are too far in the past for people to recognize the dangers of the diseases that we have found vaccines for. And I don't want to go back to a time when measles was spreading, when polio was something that anyone could get and it could leave you injured for life or even dead. We should not have to go back to those times just because maybe in recent times we can't remember how bad these diseases are, because it's not like RFK Jr. has a science-based approach to any of this. He dislikes all vaccines, and in fact, he handsomely profits from lawsuits against some of these vaccines too. So not only does he believe in pseudoscience, but he is personally, financially benefiting from tearing our healthcare system apart. And we're already seeing with the pauses on NIH grant funding and NSF grant funding, the fact that America has been leading the world on scientific research and discoveries for decades, we're losing our place. It would not be at all surprising if young scientists leave our country and go elsewhere where their research is funded and respected, rather than grants being paused for weeks, months, maybe forever. If you are not a trust fund baby, if your father was not a real estate developer that handed you multi-millions of dollars when you were born, if you are not born into a political dynasty in which you also have never had to work for a living, basic scientists need to pay their rent. And it's unconscionable what this attack on our medical system is doing, not only for experienced researchers, but for the next generation of scientists and leaders in America. We're going to lose these people, and their discoveries will be made to benefit other countries, or else they won't happen at all. And all of this because an unqualified wellness influencer decided that he knows better than people who have spent their whole lives trying to figure this out. I am not a doctor, and I would never claim to be a doctor, and I especially would not try to throw thousands of doctors out of work because of maybe something I read or saw on TikTok once that struck me as something smart and needs to be investigated more. I wish that he would focus on his area of expertise, which is environmental damage in children, and he should focus on the things that can be fixed that he knows something about. Because what he's doing is putting all of us at risk and making us less healthy. Other countries are probably loving this right now because they are going to be able to take our best and brightest upcoming scientists for the benefit of their countries, their economies. And also, if we are a sicker nation because we refuse to do basic preventative care like vaccines in favor of prayer and supplements, then we are going to have more and more sicker people that are going to go to doctors and hospitals at the last moment begging for cures that no longer exist because these hospitals, these doctors, these medical programs have been defunded, and the people that run them have moved on to other positions where they know they will be able to pay their rent and not have the money keeping their clinics open disappear at the last moment because a billionaire decided he didn't like it. We should not be subject to these Doge children running around hacking away at our government agencies and threatening our healthcare systems. We used to have the best healthcare system in the world. Granted, we don't have the best way of paying for healthcare in the world, but we have the best doctors, medical professionals, the best science. People come here for their cures. That is not going to be the case if we lose all of that to other countries that are actually funding their medical research. We cannot go back to a time where leeches were people's preferred medical treatments because that doesn't work. And in fact, I've read online that some of RFK's beliefs are so out there that he maybe doesn't even believe in germ theory. So if he doesn't believe that germs causes diseases and instead it has something to do with unclean air, we're talking about going back to cholera outbreaks. We cannot go back to a time where people didn't have chronic diseases because they didn't reach middle age. That is not acceptable for America. That is not acceptable for our healthcare system. And that's not acceptable for our government. Thank you to the senators who are standing up to this nomination, but it's not enough. We should never be here where a completely unserious person is put in charge of America's healthcare. And in a few hours, they're going to vote to hand over the keys to a man that is completely unqualified. Anybody on this call would do a better job running America's health department because at least we would listen to people that know what they're doing. He listens to, we don't even know. Is it TikTok? Is it brainworms? He is not he's not connected to science. And in fact, he tried to argue with Senator Cassidy, a doctor, about what the science said. And that just goes to show how he believes he is such an expert that he can disregard everybody else. He's going to drive our healthcare system into a ditch. And they shouldn't have to be here. Like I said, all of the Senate, except for maybe a few people, know that he is not qualified. But what they are is they are not brave enough to say so. Some senators said they had questions, they had concerns, but then they all got threatened by a billionaire with big pockets, and they all got into line and said that they would vote for this man that they know is unqualified because they're scared of being primaried. Every senator should look in their hearts and figure out what is more important, their vows and promises to the American people or their own careers. And unfortunately, we know how some of them are going to choose.
Thanks so much, Laura. Really compelling, and thank you for all your leadership and your common sense. You know, one issue that we face in this country is the price of pharmaceuticals. 1 in 6, up to 1 in 3 people in this country ration prescription drugs because they can't afford the extraordinary price. We made slight progress in the Biden administration by creating a system in which Medicare will negotiate prices for some very expensive and highly used drugs. It's the first time that Big Pharma has been defeated politically in decades. It was a modest win, but it was a dramatic political win and an important win, even though it was modest. Well, of course, Big Pharma is not just going to take that. They've been suing to try to gut the law. They've been trying to undermine the negotiation process. And they're hoping that the Trump administration will either roll back the law altogether or sabotage it one way or another. So Senator Wyden asked nominee Robert Kennedy what he thought about this in a series of very specific questions, to which Robert Kennedy gave a series of very non-specific answers. But Senator Wyden concluded, after having the back and forth colloquy in writing, so there was no confusion about this, in writing, first, that Kennedy would not commit to using Medicare negotiations to get the best deal possible on drug prices. Second, that he would not commit to rejecting Big Pharma's request to pause Medicare drug price negotiations. Third, that he would not commit to oppose policy changes to Medicare negotiations that might otherwise increase drug costs or reduce the number of drugs eligible for negotiation or delay negotiations for certain drugs. Those are all the things that Big Pharma is asking for to undermine the progress we made with Medicare drug negotiation. Kennedy refused to commit not to take Big Pharma's line on any of those. And fourth, Robert Kennedy refused to commit that he would recommend President Trump defend Medicare negotiation against Big Pharma in court. There's at least a half dozen cases that the industry has brought to try to upend the drug price provisions of the Inflation Reduction Act. The government is defending in those cases. Will the Trump administration continue to defend the law against Big Pharma? Robert Kennedy wouldn't say, yeah, he's on board to make sure the government still does that. So the man who rails against Big Pharma all the time, who says he's Big Pharma's worst enemy, when it comes to the things that Big Pharma actually cares about, will they be able to price gouge us? He can't say. He can't say. He can't answer simple, direct questions because he's not really against Big Pharma. What he's really for is undermining the safety and standards of the Food and Drug Administration so that he can get unproven treatments with an FDA stamp of approval made available to the American people. He's not for elevating standards. He's not for increasing the independence of the agency, which he says is compromised by Big Pharma. He wants to compromise it further in the direction of letting quack therapies be made more widely available. But when it comes to the real test of what Big Pharma most cares about, are you going to control their ability to price gouge the American people? He'll say something rhetorical, obviously not very concerned about it. But when he's asked about the specifics, he won't go on the record. He won't stand up to Big Pharma. All right, let me throw it back over to my co-moderator, Alex from Social Security Works.
Thanks so much, Rob, and thanks to everybody who has joined our town hall. And, we've got thousands of people watching across social media, and over the next hours, we're going to continue to push out what the Democratic senators are doing right now on the floor, which is speaking and taking up all of the time that they can to expose the dangerous agenda that RFK Jr. Will be bringing to the American healthcare system. And it's just remarkable what we are talking about. Not only an unqualified man, but a dangerous man being put in the position of deciding what science gets funding, what science doesn't get funding. This is not a scientist. This is, in fact, a person who doesn't believe in science. As Laura pointed out, you don't know where he's getting his information. Just something he saw on TikTok, something that he came up with out of his brain. But he's making judgment calls, and when he's pressed on not on the science side, we know he's anti-science, but when he's pressed on, are you going to turn our healthcare over to the corporations that deny care, that delay care, that cause sickness and death? The answer was yes. I'm going to turn Medicare over as quickly as possible to United Healthcare. They'll be the biggest beneficiary of the privatization of Medicare. This is the United Healthcare that makes billions and billions and billions of dollars doing one thing: denying healthcare. They don't provide healthcare, they deny healthcare. That's how they make their money. When we are looking at what the Republicans are proposing right now to quote unquote pay for their tax handouts to Elon Musk. It's Elon Musk, the unelected billionaire who is seemingly able to do whatever he wants from this position of co-presidency with Donald Trump. Elon Musk is going to get an enormous amount of cash directly into his pocket. And where does it come from? It comes from stealing it from us. It comes from stealing it from the working people in this country. Let me talk about Medicaid a little bit more here, because the American people understand that Medicaid is ours. The American people understand, and it's unfortunate understanding, that there is no long-term care system in this country, that the only provider of long-term care for the vast majority of Americans is Medicaid. That without Medicaid, families will be forced to somehow pay the average nursing home cost of $100,000 a year. There's no way that they're going to just magically be able to find that money. What that means is people will die. And I don't want to, dance around the edges here. People will die. You destroy Medicaid, people will die. Medicaid primarily takes care of seniors and children, the largest provider of long-term care in this country. 70 million people, tens of millions of people who get their health care from Medicaid. You don't lower the cost of groceries by stealing someone's health care. People didn't vote to destroy Medicaid. People voted because they wanted to lower prices. Seniors who I speak with across the country, often they are being crushed by high prices. They want their prices to come down. Prices haven't come down. Prices have gone up And the only proposals that we're seeing by Republicans is to do nothing about that. And instead, they're just planning on stealing our healthcare and giving it away as tax handouts to billionaires like Elon Musk. That's why we're here today in this town hall, raising our voices and focusing people's attention on what the Democratic senators are doing on the floor to try to expose RFK Jr. and the Republicans' plans to destroy American healthcare. And I'm extremely proud to be able to introduce our next guest, a true champion of healthcare for the American people, Senator Ed Markey of Massachusetts. Thank you so much. I know it's a really busy day, Senator, so thank you for making the time to speak with our forum today.
Well, no, it's just so important what you are doing. I see Rob there. I see this incredible collection of people who are dedicated to the public health of our nation. And you know how absolutely unqualified Robert F. Kennedy is, how dangerous he is. He could not answer fundamental questions about Medicare and Medicaid. And we know that that's where Trump is going to go to get the tens and hundreds of billions of dollars in order to have the tax breaks for the billionaires and more nuclear weapons. And he's also dangerous because his perspective on vaccines is absolutely at odds with all scientific evidence. So it's just absolutely incredible that there is going to be a use of his name, of his reputation, his family's reputation, that will ultimately be persuasive for, I'm afraid, too many people who won't be vaccinating their children or who won't be taking the vaccines themselves, which they need. And simultaneously, he will also be a cover for the raid on Medicaid and the Affordable Care Act and on clean air and clean water and on the Department of Education funding, and all to ensure that the billionaires get a tax break. And Rob and I did this yesterday, fund more nuclear weapons, fund an increase in defense spending, which is absolutely unjustified. So health is the first wealth, Ralph Waldo Emerson. And what they're doing is ultimately going to undermine that health, going to undermine access, going to undermine the price that people have to pay, to undermine the confidence which people have in science in our society. So I've been battling now, oh my goodness, this is now the third month of the Kennedy nomination. He used discriminatory fear-mongering, which convinced people not to take vaccines in Samoa. The list is just endless. He's just unqualified. He's dangerous. And we've been trying to make the case on the Senate floor all day long. And so this will not do anything to make things better for ordinary Americans. It's going to be Robin Hood in reverse, where they're going to be taking funding out of Medicare and Medicaid for those who need it the most, and then sending it over to defense contractors and their billionaire donors. He's going to call it efficiency, Elon Musk. But the reality is that efficiency in the lives of ordinary people really just means Medicaid. It means these programs. And Robert F. Kennedy's supposed to be the defender of it. He's supposed to be the guy who will stand up to Trump and just say, no, we have to protect these programs from the middle, but especially the programs from the mid-'60s, back at the height of his family's interest in moving us in this direction. And instead, he's going to allow his influence to be a cover for the cuts. So we have to say no cuts to Medicaid, no cuts to Medicare, no cuts to the Affordable Care Act, no cuts to health care. and that means no to Robert F. Kennedy Jr. And that's where we have to be, and that's where I'm going to be, and I'm going to be continuing to urge my colleagues to take that position all the way until the end of this debate, because Robert F. Kennedy is going to help make America sick again, and that is a true tragedy for the American people. So thank you all so much for everything you're doing. I'm looking forward to continuing to work and to fight with you.
Thank you so much, Senator. And I hope you know that the American people are absolutely against the agenda of RFK Jr., and they've got your back. The American people want access to health care. They want to be able to go see a doctor if they get sick. They don't want some insurance bureaucrat to tell them, oh, where's your prior authorization? They got it from the doctor in the first place. So thank you for your leadership. And I know you're doing everything you can to fight. I also know that the Republicans have the majority. And so we're going to need the people to stand up, raise our voices together, and demand that all politicians in D.C. listen to the people and not their billionaire donors.
Well, I'm the chairman of the Health Subcommittee in the Senate. On the Health Committee, I'm the chairman of the Health Subcommittee. Any of you out there, as we're going along, please call me. I want to partner with you. This is going to be a long twilight struggle, and we are going to win it long term. But we're going to have a high energy level and battle every single bad decision which emanates. And I just want to be all of your partners in this battle. Thank you all so much for doing this tonight. Much appreciated.
Thank you, Senator. And, again, what we're doing today and the reason that we're having this forum is because right now on the Senate floor, the Democrats in the Senate are doing everything they can to slow down the confirmation of RFK Jr. By taking up as much time exposing his agenda as possible. And we want people to understand that that's what's going on. There is an enormous amount of work happening, but the Republicans do have the majority. They can put in place who they vote for, and they're scared. They're more scared of billionaire Elon Musk than they are of their bosses, the American people. And until we change that calculus, we are going to continue to see this assault on our system. I am going to introduce a video from Senator Mark Warner of Virginia, who is a champion in this fight and sent us a video to ensure that the American people know, again, that the Democrats in the Senate are fighting for our health care. They're fighting against the assaults on our system. So I want to play that now.
Hi, I'm Senator Mark Warner. I want to thank Public Citizen, Social Security Works, and Protect Our Care for hosting this really important Tele-Townhall. Because, folks, while it seems like it's been forever, it's been less than a month since the Donald Trump chaos show has come to our nation's capital. We've seen already in these first few weeks shutting down at independent agencies, dismantling 70 years of public diplomacy in terms of soft power by eliminating AID. We've seen efforts of the Doge brewers getting into our nation's most classified data files in ways that are only going to bear mischief. And the truth is, at this moment in time, we need to put people in charge of agencies that will have the independence to stand up, and that, particularly in healthcare, that will base their conclusions on science. Now, unfortunately, Mr. Kennedy, Trump's nominee for HHS, is not that person. I fear he will be nothing but a rubber stamp for the Trump-Musk agenda. And look what's happened already. Early in the month, the president froze all federal funding. Then it was unfrozen. Yet still, in my state, things like community health centers are not being funded. And unfortunately, some of the most rural parts of Virginia are closing their doors and laying people off. These are voters that voted overwhelmingly for Donald Trump. How is this lowering the price of groceries or eggs? Instead, it's wreaking havoc with the lives of the underserved. In Buckingham County, again, a very rural county in Virginia, they have been put on hold for a machine that would be the only one in the region that could help spot women's cancer. With the freeze, we don't know when or if any of those funds are going to come back. And as we see now some of the Republican budget proposals coming out, they clearly will cut Medicaid. Unfortunately, Mr. Kennedy, we had an individual during testimony who didn't even understand the difference between Medicaid and Medicare. For all those reasons and so many more, I will be voting no on Bobby Kennedy Jr.
That was Senator Mark Warner from Virginia, joining the chorus of common sense people opposing Robert Kennedy to be Secretary of the Department of Health and Human Services. Well, we've heard a lot this evening. We've heard from some great congressional champions and some amazing health champions. We've talked about Robert Kennedy's anti-science perspectives. We've talked about his anti-vax positions. Did you know, by the way, that he petitioned the Food and Drug Administration 6 months after the COVID vaccine got on the market to take it off? A move that, if it had succeeded, would have cost hundreds of thousands of lives or more in the United States and millions potentially around the world. We've heard about his anti-vax positions. We've talked about his conspiratorial mindset. We've talked about his planned attacks on these scientific institutions at the National Institutes of Health. We've talked about his lack of concern for the core healthcare issues of people in this country. Can they get access to a doctor? Can they pay for that doctor? Can they get the medicines they need and pay for them? Not just a lack of concern. Under question, he said he wants to make the problem worse. He wants to privatize our Medicare system. He will support restrictions on Medicaid. He's for sure going to go along with the Project 2025 agenda of gutting the Affordable Care Act, doing things like permitting junk plans to be sold and removing the subsidies available for lower income people getting health care out of the exchange. He has showed himself to be, as we've discussed on this town hall, profoundly unqualified for a singularly important job of protecting the nation's health. So where are we at this moment? Well, the Senate debate continues, and if you're watching this, please call your senator, tell them you're behind them to oppose this nomination or demand that they oppose this nomination if they haven't already come out against Robert Kennedy. When we get to the other side, if he is the Secretary of Health and Human Services, there are going to be problems, and we're going to have to fight him every single step of the way. And we're going to have this massive fight in Congress over this plan to strip away health care, most importantly for the poor and vulnerable, but for all of us, in order to pay for tax cuts for corporations and the super wealthy. And although the Republicans have very tiny majorities, or maybe because they have such tiny majorities in both the House and the Senate, there's nothing preordained about them being able to deliver on that horrendous idea. We have defeated the anti-health agenda of the Trump administration already in its first 3 weeks. We defeated the core anti-health, anti-public health agenda of the first Trump administration, rolling back the Affordable Care Act. And if we all mobilize, we're going to defeat this even worse idea coming forward. It's lined up for us. There's a lot of power lined up against us, but the issues are clear. And if we all come together and mobilize, if everyone in this town hall commits right now that they're going to be in this fight, they're going to reach out to other people and bring them into this fight, combining with millions of other Americans across the country, we are going to succeed. Robert Kennedy, for sure, is not the pathway to make America healthy again. But we, the people, are. Not just again, but to make us healthier than we have been, to strengthen our public health institutions, to make the Food and Drug Administration what it should be, more independent from pharma with higher standards, to put more money into healthcare R&D, and to deal with this most fundamental of problems, transforming from a system that makes healthcare a commodity available to those who can pay, but not to those who can't, into a system where healthcare is a right available to all, where we can get the healthcare we need, where we can get the medicine treatments we need without paying exorbitant prices, without going into medical debt or facing personal bankruptcy or worrying about we might have to sell our homes. That's a society that we can have. That's a society we're certainly rich enough to have. And that's a society we are going to have when we all join together. Winning this defensive fight that's coming up is the first step in launching us forward, not just to stopping bad things from happening, but winning the transformations to give us the fair, just, equal, democratic, and healthy society we should have. Thank you all so much for joining this town hall. Please stay in touch. Please stay together. Please stay safe. Thanks, everybody.